Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Mental Health and Community Wellness. Questioning for this department will continue in a global manner. The floor is now open for questions. The member for Point Douglas.
Thank you, Mr. Speaker. Can the minister, I think the minister last time had answered this question. They had said that there was no vacancy rates in their department, but can they tell us how many the number of current vacancies by sub-appropriation in their department?
The Honorable Minister of Mental Health and Community Wellness.
Yes, thank you for that. So I do have those numbers. So by sub-appropriation, the total number of FTEs for the department is 60.2. And so that would be broken down into one for minister, executive support is 9, division support is 3.5, mental health and recovery branch is 25.8, chief provincial psychiatrist is 2.9. The mental health review board is 3 FTEs. Health and promotion and wellness is 11 FTEs. Tobacco cessation is 4. So that makes up the 60.2 positions within the department. So the vacancy rate, which is what the member was asking about, so obviously there's no vacancy rate for the minister. The executive support, we have 1 FTE vacant. In the division support, it's 0.5. In the mental health and recovery branch, 7.8. There are no vacancies in our chief provincial psychiatry. The mental health review board, we have 1 vacancy. The health and promotion and wellness, we have 3 vacancies. And then the tobacco cessation, we have no vacancies.
The member for Point Douglas.
Thank you. So of the 60.2 FTEs, 10 of those, or 9, the minister had just indicated, are those for the minister and her executive support. Do you think it's a bit top heavy when a quarter of the department is support for the minister?
The Honorable Minister of Mental Health and Community Wellness.
So the numbers that we have within our department are consistent with all departments, and this includes our front office staff. So I have an ATM or assistant to the minister who does a lot of my scheduling. I've got the 2 secretaries up front, and then I have 2 political staff now, one who had just started on Friday. So when I was last up for estimates, I had one current, who is Jeff Chachanoff, and one new political staff who just started last Friday, that is Sarah McLaughlin. And then within my deputy minister's office, so that would include my deputy minister, there's also 2 positions there, 3 positions. One currently is on mat leave, which is the vacancy that I had mentioned earlier.
The member for Point Douglas.
I thank the minister for that answer. What has been the actual funding provided each year to the Addictions Foundation of Manitoba over the last 5 years?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Okay, so is a little bit of research here to find some of these numbers. So first of all, AFM is considered an other reporting entity, and of April 1st of this year, it is now under shared health, not under our department specifically, but you can get the specific numbers of government investments into AFM on the public documents that are on their website for their annual reports. But from what we've looked up, we have from 2017-18, 23.8 million to AFM. From 18-19, 23.8 million. 19-20, about 24 million. From 2021, again, about 24 million. And 21-22 at the 24.2 million investment. But the specific amounts in more detail can be looked up online, and the public has access to that.
The member for Point Douglas.
Miigwech. I thank the minister for those answers. I'm going to ask a couple questions, just if they could clarify whether that 24.2 million and 21-22 included the 3 million from the flooding. But then my next question is, I'm going to move on to overdoses in Manitoba. So can the minister provide us an update on the number of suspected overdoses this year?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. I'll get to the first question first. It was one of those discussions that I had with the previous member who was asking questions about sort of the difference between summary versus core. So the numbers that I provided were the core investments and funding through mental health department. There are other funding sources also in other departments from the government that flow into AFM. But I was commenting on the core services. So when you speak about the flooding, sorry, when the member speaks about the flooding, that would be under summary funding. So any sort of extra revenue or other revenue, whether it's through insurance or whatnot, would not affect the core investments. That would be part of summary budget, not our core investments. And then you on the follow-up question about overdoses.
The member for Point Douglas.
While the minister is taking that under advisement and looking for those numbers, can the minister also advise other jurisdictions except Manitoba have databases where they keep accurate, up-to-date numbers? And I know the member has, or the minister knows that a community has been advocating for this. So I'm just wondering, is that something that's going to be coming in the near future, where we're having accurate numbers on the federal database of how many overdoses are happening in Manitoba and how many currently has happened up to date?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. And I just want to clarify, I actually did not take it under advisement. I'm just going to be speaking with my staff right now so that I can give an accurate, updated answer for the member.
The Honorable Minister of Mental Health and Community Wellness.
Yes. Okay, so I know that the member and I have had a number of conversations, sidebar conversations about reporting and the numbers and talking about the national database and website that is provided. I will note that the Manitoba numbers are right now currently up on the national database for the year 2021, which when we previously had spoken, they weren't there. And that's a function of actually a delay in terms of our reporting deadlines are different than what the federal reporting deadlines are, and they require that the numbers that are submitted are audited. So our reporting deadline for auditing is different from the federal deadlines and their reporting processes. And so the numbers aren't posted on the website, the national website, until they are actually audited. But we are continually providing the federal government with the numbers from Manitoba, but if they are unaudited, they are not posted online. It's after they are audited and verified that those numbers are then put online for public access.
The member for Point Douglas.
Thank you. Can the minister provide an update on the number of suspected overdoses, and then how many have lost their lives to overdoses this year? An accurate number.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chairperson. And again, I'll reiterate that the numbers that would be preliminary have not been audited and they haven't been confirmed. So those numbers can go up and down. And there's always a 3-month delay in terms of toxicology reports and other entities. And other jurisdictions actually post their unaudited numbers. And those numbers can change throughout the year because in the end, once the information is provided through the medical examiner's office, those, cause of death could change depending on what the findings are. So we historically have not revealed these unaudited numbers, which is the only numbers that we have access to, because they have changed. And I would not want to be putting numbers on the record at this point that are not audited. But I know that the member was curious as well about, keeping the public up to date on the activities and some of the areas of concern and being transparent. And our department has been consistently working on making sure that we're collecting the data and having it ready for a format that the public can keep on top of what is going on, both the areas of improvement and the areas that need more investments and supports.
The member for Point Douglas.
Miigwech, I thank the minister for that answer. In July, I actually contacted the medical examiner and I was able to get a number of 107 deaths here in the province in the first quarter. So I'm wondering why I can call the medical examiner's office, get those numbers, and they've done already toxicology tests and determined that these were overdose deaths from opioids. Why we can't accurately report. And I know what the minister's saying, that they have to be very clear, but the medical examiner, when I called, was very clear that those toxicology reports had been done, that it was a clear indication that the person had died from an opioid overdose. And we're at 107 in the first quarter. Last year was 407 deaths. The year before was an 87% increase. We're on schedule to even, forego that number and exceed that number. And I think it's, to educate the community on what drugs are out there, what's actually happening, even going as far as drug testing. We have, Sunshine House that has taken it upon themselves to actually fundraise. They got some funds from the federal government to be able to buy an RV. They have asked the province to support a drug testing machine that's at the cost of about $80,000, which would help save lives because people can test their drugs, make an informed decision whether they're going to take that same drug that they took yesterday, but they don't know if it has more fentanyl or more whatever in it. They took the same drug, but yet they're dying from it. So I'm wondering if the minister can speak to, whether there's any strategy to reduce the numbers of Manitobans that are dying from overdoses, and how are we going to educate and help support the folks that are already doing the work and that are taking it upon themselves to actually do the work. We have a responsibility as a government to ensure that people have access to resources, and testing drugs is one, but also making sure that there's accurate, up-to-date information so people know that people are actually dying from overdoses in this province. I don't see anything on any social media. I don't see anything unless I'm directly connected to them, I don't see anything on media. I don't see anything that comes out from the government. And I think it's not okay for us to, pretend like it's not there. It increases the stigma, actually, and doesn't help people come forward to get the help they need. So again, I'll ask, why am I able to get those numbers from the medical examiner who has done the toxicology reports that have actually said that 100% conclusively that this person died of an overdose from whatever drug it is, and they can tell you what drug they overdosed from? Why are they able to get those numbers? We're not, and why aren't we reporting them on a database? And I get that, you've said that, but that's red tape. We need to reduce that. We need to make sure that we're getting people the right information and that people are making informed decisions and that we're getting people the resources that they need so that we can save lives.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair, and I think that there was a number of questions sort of balled up into one, so trying to unpack some of that. Um, so first, I also want to clarify that the Chief Medical Examiner falls under the Department of Justice. So numbers flow through the Department of Justice and then flow through to our department. I'm not going to be arguing with numbers that are coming from the medical examiner. However, I do trust that he also clarified that those were the unaudited numbers, and as confident as he is in cause of death and what information, and again, I wasn't a part of those conversations, I'm not going to argue about numbers that were provided. I wasn't part of those conversations, but again, I want to sort of reiterate that those are the unaudited numbers that would have been provided through the Chief Medical Examiner's office, and those ones would sort of be confirmed after the audit is completed. In terms of the focus or not speaking enough or sharing enough on supports for people who are struggling with drug and mental health issues, I would actually argue that we've done a number of initiatives as a government and investments. And most recently, in August, we announced an additional over $500,000 into expanding the rapid access to addictions medicine services in Selkirk. And I know that was very well received by families who have loved ones who are struggling in the area and really looking for services to help their loved ones get back on their feet and back on the path of healing and health. We've made a number of announcements of investments that we are making in terms of psychologist positions and in terms of youth mental health supports, including opening up the youth huddles throughout Manitoba. And I know that was also well received by our young generation who are facing far more pressures when it comes to mental health and drug pressures than I think what the member and I even faced growing up. So in terms of keeping this front and center and the dangers of not having access to services to help us, get back on our feet, we have done a lot as a government. We will continue to invest more and continue to work on what we know are evidence-based practices to restore the lives and health to Manitobans.
The member for Point Douglas.
Miigwech, 107 deaths this year in the first quarter alone. I would beg to defer that we're not doing enough. We have Manitobans that are dying every day in this province, and they don't have access to the supports that they need. $500,000 to RAM in Selkirk is great, but obviously we need to be investing more money because the numbers continue to increase and people aren't getting access to the supports they need. So I'll move on. Can the minister tell us how many babies were born with congenital syphilis this year? We know last year was 47. And is there an updated number so far for 2022?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So I know that this topic has obviously been raised in the chamber during question period a number of times, and a number of times we've clarified that this actually falls under the Department of Health. So sexually transmitted and bloodborne infections, I do agree that there is that need to really look at the whole scope of, intravenous drug use and sexually transmitted diseases and how they, impact over a lifespan people who are facing challenges in life. But at this point, the sexually transmitted and bloodborne illnesses do fall under the Department of Health. So those numbers are not within my department to provide, and I would suggest that you speak to the Minister of Health to have access to those numbers.
The member for Point Douglas.
It's unfortunate that the minister doesn't have those numbers, because those are a direct result of intravenous drug use. When you're talking about syphilis, when you're talking about hepatitis B, when you're talking about HIV, and not having those numbers, is something that I think that the minister should be looking into and making sure that they have access to, and that, the two departments work together in collaboration, because that's certainly going to help reduce those numbers and making sure that people have the support that they need. Departmentalizing those issues when it's directly related to addictions falls under that portfolio. And, it's great that we have another minister that, is looking at mental health and recovery, but recovery also means looking at what is a direct result of the addictions that are coming from people actually using these drugs. So, and again, I know the minister had talked about the medical examiner not falling under their purview as well. I think that, that's harmful in terms of making sure that Manitobans have the support that they need and the information that they need to make informed decisions, as well as the department has those numbers so that they can look at where supports need to be and investments need to be made. And certainly, the rise in all of these areas, whether it's, babies being born with congenital syphilis, being born or contracting HIV, like these are life-altering diseases that people have to live for a lifetime with. So, I certainly think I shouldn't be going to another department to find that out when it's directly related to an addiction and issue that people are using intravenously. But I'll move on. So the Virgo report called for 9% of the health budget to be focused on mental health and addictions. How much is it now? How many of that 9% is being allocated towards mental health and addictions?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. And yeah, just to respond to the member, I know that the member has a number of suggestions for how they would structure government and different departments, and I'm sure that there are some keen ears listening in, with some of those suggestions about how best to structure and have reporting entities come up through various departments. So appreciate the comments that were shared, and I assure the member that ministers are not the ones who determine what line of reporting happens in which department. That is done by people with a higher pay grade than myself and much smarter than I am. So having said that, I do want to correct the record that Virgo report indeed did not say 9%. The national average aims for 7 to 9% of overall health spending should be on mental health funding. The Virgo report actually pointed at a 7.2% aim for Manitoba. And just looking at where our government came in 2016 and 17 was at a historic low after years of being under funded. So under the previous government, we were starting at an all-time low of 5.39% of overall health spending being spent in the mental health area. Since then, we have increased the funding year over year. So 2017-18, we were at 5.2%. 5.42%, my apologies. 2018-19 was 5.55%. 1920 was 5.58%. And then in 21-22, overall was 5.65%. And that's specific to our mental health funding agreements and investments, but it does not include, the 22-23 is up to 6.23%. Quite a big jump there, recognizing separating out our department into be a standalone department and having separate funding and making large investments in the areas that are needed for Manitoba. Now, these costs these funding amounts are specific to my department. They don't include a number of other areas that are funded. For instance, people who are seeking mental health care through primary care, those costs are covered, emergency rooms, out-of-province travel for mental health patients, and including some of our Naloxone programs that we're providing. None of those are included in the numbers that I provided to the member. So if you were to add up those costs that are covered for mental health services in general through other departments, including justice, we'd be well over the 7.2% that is called for in the Virgo report.
The member for Point Douglas.
Which I thank the minister for that answer. Can the minister tell us how many hours a week RAM clinics are operating?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. I'm just wondering if the member could clarify if she's looking for the walk-in hours or the clinical hours, or both.
The member for Point Douglas.
Both, if you want to provide both of those, that would be great.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So, when we're looking at the hours for RAM clinics, on average for the walk-in, they usually do a block of 3 hours on any given days, and all of them have different days that they will be open. Some of them are Tuesdays, Wednesdays, and Fridays. Some of them are Monday and Thursdays, and that's for walk-in hours. The clinical hours are Monday to Friday, 8:30 a.m. to 4:30 p.m. So there will be clinical hours where the healthcare professionals or the addictions specialists will be working with their clientele and not open for walk-in appointments. But between 8:30 and 4:30 p.m. on any given day, there can be appointments made by people looking for services. And I think that is, we did expand hours due to the pressures of COVID. And that was a direct response to the needs that were being expressed by Manitobans. Overall, the response to opening RAM clinics that I will remind the member didn't exist under the NDP government has been positive. There has been a very good response to opening these clinics and providing the services that are barrier-free to individuals who are struggling and recognize the need for services and supports in their walk towards healing.
The member for Point Douglas.
Miigwech, I thank the minister for that question. Again, 3 hours weekly per clinic. We have, the number going up every month. I did get a text from someone that had got numbers up to May that indicated that 189 folks had passed away from overdoses in our province. And I know the city is keeping data in terms like if a first responder, paramedic, or a police officer responds to an overdose, where those are, the hot spots, whether they were taken to the hospital. So they're keeping quite up-to-date data. And, that's something I hope our province can get to because we are lagging far behind any other province in this country. And, it's resulting in people's deaths and we need more services. So I'm wondering if the minister can tell us by site the number of treatment beds are currently operated in Manitoba, and if the minister can include other types of beds, like differentiating between treatment beds or other supportive housing.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. Okay, so now we're getting into the treatment beds, and it's broken down to, we have in-house treatment beds, and the number there is 332. That does not include the private treatment centers. So the numbers of actual beds for treatment is much larger than that, but these are the number that we fund through government. The supportive housing, previous to our department working on this, there were 130 roughly beds. There are currently 234. So our government has invested over the last 2 years at 100 net new supportive housing units, which doubles the number that had been created under the previous government in 17 years. So we're actually quite proud of that number and accomplishment, and celebrated along with the stakeholders that we did recognize the need for individuals to have the supports as they are healing and returning to health in their life. Withdrawal management beds, there are a total of 99.
The member for Point Douglas.
Which I thank the minister for that question. There's less treatment beds now than there was in 2015. Why is that?
The Honorable Minister.
Thank you, Mr. Chairman. Yeah, in order to answer the member's question about why the change in numbers, Salvation Army, which is an independently run organization, had decided to close down their 32 beds that they were operating. That wasn't a government decision. That was a separate organization who decided to close those beds. The funding that was provided for those 32 spots to Salvation Army was then reinvested into the supportive housing and treatment areas. As we recognize there was a large gap in supportive housing that was necessary to keep those who had sought treatment in recovery and supported as they found their way back towards healing and restored their life.
The member for Point Douglas.
I thank the minister for that question. I'm struggling here a little bit because we have so many people that are struggling with addictions to get into treatment beds, but yet we've taken those 32 beds, put them into supportive housing, which we should be investing more in anyway, and topping up those beds so that people can get to actual recovery. I know during the pandemic, for instance, we had less detox beds, and I heard that from a number of folks that were trying to access those services. But I'll leave that there. I want to move on to harm reduction initiatives, and I'd like to ask the minister what funds are being allocated to harm reduction initiatives, and what are the harm reduction initiatives that are being invested in.
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chairman. So first of all, I'm going to take issue a little bit with the member's preamble, where there's a suggestion that there was less supports available for people seeking treatment, and what we've based our decisions and funding allocations on are needs-based planning. So there's an assessment done of how people seek treatment and what the needs are, and what we've seen, and I know that the member would be familiar as well with this, is that a number of people who seek treatment don't necessarily reach success the first round of treatment, and maybe that's based on how long duration that's been provided, or most frequently what happens is that there's not supportive housing available when they actually have reached that level of ready for the next step of that recovery process. And so what happens is they end up relapsing and then accessing treatment spaces again. So indeed, investing in the supportive housing, including additional investments into our treatment beds, means that those same individuals are not going through that revolving door and repeatedly needing to use the treatment. They will have those supports available to them long-term to keep them in that healthy recovery. And I would argue that that treatment and the supportive housing is actually the most effective harm reduction initiative any jurisdiction actually can invest in, because it truly does restore lives and helps people to get back to the baseline of health and healing. But additionally, our government has invested over $1.5 million in harm reduction initiatives, and that includes the Naloxone take-home program and providing clean needles to individuals who are using injectable drugs.
The member for Point Douglas.
Miigwech, I thank the minister for that answer, and I don't agree with, or I don't disagree with investing in supportive housing. I absolutely agree with that, but I think that we should be making extra investments instead of taking the 32 beds that we lost that were for, treatment, and investing those into supportive housing. So we need more investments, not less, more beds for detox so people can get to that place of supportive housing. And I know the minister referenced that, people relapse and, they kind of cycle through, and that's great. But when there's no treatment beds to go back to, then, that means people are less likely to get back to that supportive housing model. So we need to make sure that those supports are there when people need them and they need to go back into treatment. I've met so many people who, and we know that addictions is a lifelong struggle, that it's not, I go to treatment and I'm cured, that people every day, have to fight and really make sure that they have a supportive system. So I've heard from folks that, feel like they're in supportive housing, but they're going to relapse and they need to go back to treatment. And often there's not treatment beds there for them. So that's where I'm coming from, that we need to make more investments in treatment beds to ensure that it's not a revolving door for folks, that they can, truly get on to a track where they're fully supported, and it's a holistic model where they're looking at long-term treatment, because we know with the drugs that are being used now with, meth, that it's not a 6-month, kind of thing, that people need a lot longer than that for the serotonin to, get back to some normalcy. It's never going to get back to full normalcy, but that we need longer term housing even beyond, the 6 months or the 30 days in treatment. And I know the minister knows that. So that's what I was getting at. I want to move on though to, I'm thankful that there is Naloxone. Certainly, that was something that, I heard resounding from families and people on the front lines that was needed. So I thank, the government for investing in that. And, providing needles, that's great, but we also need to go further than that and provide safe consumption sites. I visited a number of provinces, and it's evidence-based that it's proven to save lives. Nobody has ever overdosed and died in a safe consumption site. The number of bloodborne diseases are reduced, and the police have even gone so far as to say that crime has been reduced in the communities that are served by safe consumption sites. So I know that the minister had spoken about that some time ago to the media in terms of, that was something that they were looking at. And I hope that that is something that we're going to see in the future invested in, because, again, it's been proven to save lives, and we need to make sure that people aren't dying of overdoses. They know what drugs they're using. There's someone there that's medically trained to support them if they do go into an overdose, and that they can get access to the supports that they need, because it's not just about providing a safe space for people to use. It's also providing access to primary care providers, to housing support people, to counselors, to addiction specialists. So it's more than just that. And I think that when people hear the term safe consumption sites, that there's some stigma attached to it. And I want to assure that, every single, and I visited about 5 of them now in different provinces, that and I've met with social workers, I've met with primary care providers, I've met with the police in all of these different provinces, and they've all said that 80% of the people who access these services either go on to become mentors, 30% go on to never using again and coming back and actually working in these places. And like I said, nobody has ever overdosed. And yeah, so I hope that's something that this government will look at in terms of harm reduction. But I'll move on to tobacco cessation. The salaries for those working on tobacco cessation declined year over year by $127,000 or 34%. Can the minister explain why the reduction?
The Honorable Minister of Mental Health and Community Wellness.
Thank you, Mr. Chair. So first, I will address some of the comments that were made by the member in terms of harm reduction or specifically safe consumption sites. And what I had committed to in the comments that I had made was that I would look at all the evidence that was coming forward from jurisdictions who had sites that were running and other jurisdictions that were sort of newly into that realm versus others that had been running for a number of years. And although I won't argue too much over some of the details that the member is providing, the evidence that is coming forward is not the same as what the member is quoting. So from a Canadian review in 2019, there were actually increased opioid-related calls for emergency medical services in the immediate vicinity following opening of some of these sites, as well as crime that's measured by police for calls for services generally had increased in the immediate vicinity in contrast to areas that did not have the sites, and also the needle debris had increased in and around the sites. And those are a couple of the cautionary notes when considering this particular harm initiative or harm reduction initiative idea. So I continue to look at the evidence that is coming forward, and really the focus needs to be on the treatment and recovery. And ultimately, I've yet to meet a family who wishes for their loved one to continue with the struggles. And if given a choice between a treatment center that they would have evidence and hope that could lead to recovery versus having investments put into more of these areas which would be considered the supervised consumption. I know from personal experience the choice is a very easy one to make, and it doesn't mean that the initiatives or some of the efforts that are put forward by a number of groups who are trying to assist those who are struggling with substance use are not valid and appreciated. But our government's focus has to be on increasing those core services and providing hope to families and those who are struggling to restore their lives. And then to answer the smoking cessation funding. So the explanation for the amounts being spent in that area going down is because we've had a number of staff retirements, and then the new staff are brought in at a lower salary.
The member for Point Douglas.
Miigwech, this will be my last question. And again, I just, I hear what the minister is saying about opioid use and, all of that. But again, I would ask the minister to look at whether anybody has ever overdosed and died in those sites. Any site that I've visited, no one has ever died. And people are overdosing in the public versus in a space where there's medically trained staff that are saving lives. That's a huge difference. Needles are riddled all over, and they're in a space. For instance, if you go to Hastings, right, there are still people using outside, but within like half a block of the safe consumption site. So they can get support right there. And again, it's all about having access to make the right choices and having the supports there to move people along that line. And those spaces have those things attached to them. So it's not just about someone coming in and using. It's about having access to medically trained staff, to have access to, if I've used every single vein in my body and I have infections all over, that's going to decrease my life expectancy. That's going to decrease my health outcomes. So these places and spaces have medically trained staff to help people use safely, to make sure that they're not getting infected, to make sure that they have the supplies that they need to make informed choices. And it's not all about use. It's about helping people move on to that recovery. And most places have people who are working there that have been in that same place. And, we need to start thinking, how do we move people to places where they can get that support? And getting into treatment isn't always a person's choice at the beginning. They have to have someone who believes in them, that gives them hope. And that sometimes is someone who is at one of those sites. And I've talked to so many of, people who are mentors at those places, that are in those chill rooms when people have used and they're moving on to that are supporting and talking to them, helping them to know what supports are there if they need it and when they choose to decide to make that choice, and making sure that those supports are there when they need it. So it's not all about, it's about saving lives for me. And I'm actually going to close out because we have to move on to the next area. So I will close out mental health and recovery.
So the member for Point Douglas has no further questions. We will now proceed to consideration of the resolutions. Resolution number 24.2. Resolved there be granted to His Majesty a sum not... Resolved that there be granted to His Majesty a sum not exceeding $31,625,000 for mental health and community wellness, mental health and recovery for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.3. Resolved that there be granted to His Majesty a sum not exceeding $10,169,000 for mental health and community wellness, wellness for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.4. Resolved that there be granted to His Majesty a sum not exceeding $62,875,000 for mental health and community wellness, physician services, psychiatry for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.5. Resolved that there be granted to His Majesty a sum not exceeding $283,337,000 for mental health and community wellness, funding to health authorities for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.6. Resolved that there be granted to His Majesty a sum not exceeding $786,000 for mental health and community wellness capital funding for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.7. Resolved that there be granted to His Majesty a sum not exceeding $266,000 for mental health and community wellness capital assets for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.8. Resolved there be granted to His Majesty, resolved that there be granted to His Majesty a sum not exceeding $3,545,000 for mental health and community wellness, other reporting entities capital investment for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. The last item to be considered for these estimates is item 1 brackets A, the minister's salary contained in Resolution 24.1. The floor is open for questions. No questions? Resolution 24.1. Resolved that there be granted to His Majesty a sum not exceeding $1,306,000 for mental health and community wellness, executive for the fiscal year ending March 31st, 2023. Shall the resolution pass? The resolution is accordingly passed. This completes the estimates for the Department of Mental Health and Community Wellness. What is the will of the committee? The Honorable Minister of Environment, Climate, and Parks.
Call it 5 o'clock.
Committee rise.
Is there?
Oh, committee rise. Committee rise.
Yeah.
Well, we can recess for the next department if you. No, if you want to we can definitely recess for the next department.
Yeah. Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Environment, Climate, and Parks. Questioning for this department will continue in a global manner. The floor is now open for questions. The member for Wolseley.
Thank you very much, Chair. I realize that the answer to this question is unlikely to come until tomorrow, but since we were talking about protected areas yesterday, I would like to ask the minister about watershed districts and watershed planning. And if he can be prepared to talk about what results have been achieved for the money spent, including money spent from the Winnipeg Foundation Trust Funds. And specifically, is there a net gain of wetlands in Manitoba?
The Honorable Minister of Environment, Climate, and Parks.
Well, thank you very much, Mr. Chair, and certainly it's a pleasure to, again, pick up where we left off yesterday and the day before. Certainly pleased to be here to take questions from my critic from Wolseley. And when we talk about watershed districts, glad to expand on this answer tomorrow, but certainly we are proud of the investments we are making with our partnerships with the municipalities as we continue to grow watershed districts throughout Manitoba. As a matter of fact, we've added additional watershed districts.
The hour being 5 p.m., committee rise.